How about Carol? Let's go on to Carol.
Yeah, let's have a little look at Carol. Yeah, Carol was she was a hairdresser, like you say, and she kind of built a business here in Newcastle. Actually, she's got salons here, and she contacted us with the kind of follow. I'll read her symptoms out. She said for the last 6 months she's had digestive discomfort, and like it felt really strange for her, because it was even when she just drank water. It wasn't just foods, but it was water as well. She was finding it particularly difficult to digest fats as well in her foods. She was really tired. She had really poor quality sleep, which is probably partly why she was tired. Had a lot of muscle and joint pain, was nauseous, loads of mood swings, and was just feeling like tearful, just for no other apparent kind of reason. So I said, well, what happened 6 months ago? And she described it, and she said, because sometimes it's gradual, isn't it? The onset of stuff.
Yeah.
It was very sudden. She pinpoints it, and she said she went out to an Indian restaurant for a meal, and then that night she was violently sick. So obviously the body was just clearly trying to eliminate something, violently sick. And in her own words, she just never felt right since. And she was obviously telling us this 6 months later. In those 6 months, what she'd done was see a doctor, and they'd run an endoscopy camera down the throat, and they found they could see some inflammation, and they took a biopsy and found H. pylori again. It comes up a lot, doesn't it?
Yeah.
That stomach bacteria, typically in the stomach, that bacterial infection, which can be quite problematic for some people. So once they'd found it, they then did the antibiotics, which is that sort of medical approach. So she took antibiotics, didn't feel any different, didn't feel any improvements particularly, did a retest, a breath retest that was negative. So as far as the doctors were concerned, it's kind of like sort of job done. You should feel fine, but she didn't. She essentially felt the same. So she still worked with them to say, well, what do we do now? And they said, we'll take more antibiotics. Yeah. So she took a second one, and it could have worked, but maybe the antibiotics did eradicate the H. pylori. It's possible they went and did their job, but ultimately what we're interested in is, how does that person feel? What's the quality of life? And so even after these antibiotics, still no difference. And by this time it's 6 months later, and she's contacting us saying something's not quite right here. So she did a comprehensive gut test, because this is where we've got to look there. We haven't looked there comprehensively yet. The challenge with the medical approach was try and guess what it is, then test exactly for that. Whereas we might say, well, we don't know what it is, because we'd be guessing. So let's try and guess broader and see what it is, and see if there's...
Yeah. Let's run a test that checks as many things as possible and see what's there, rather than projecting what is going to be there.
Exactly. So many times from doing that, we found some significant stuff for people. I don't know when you would ever get round testing for that if you tried to pre-diagnose it.
Yeah. Then
test if it was there. It's sort of, well, it's a different way of doing it, isn't it? But H. pylori came back on the test, and 2 parasites, fairly challenging parasites for some people. Now, how long have they been there? Have they been there for a week before the test? 6 months? Was that part of some food poisoning episode in the restaurant? Have they been there for 10 years and being a little bit asymptomatic? We don't know. But she's got 3 key pathogens in her gut that you wouldn't want in your gut. Doesn't matter who you are. So straight away we knew, well, we've got something to work on. You found something out that you just did not know previously. Now, either the H. pylori was there all along and it never was negative, and the breath test was a bit of a false negative, or there's something in her environment, or for some reason she got rid of it and then it came back, or something. It's guesswork. But what we know is on that day, and when we're working with her, it's still there, and it's still probably a challenge. So that functional medicine, the insight that running those kinds of tests on your gut just gave us the insight that we needed, really. So gut healing steps that she put in place, eradicating bad bugs, helping her body eradicate those bad bugs, improving levels of inflammation, improving digestive capacity and things like that, were just essential for her. And it only took her 2 months in putting those steps in place to actually alleviate all the symptoms I listed. So she was, pretty happy with that, because it was relatively simple when you've got the information.
Yeah. And I think there's a couple of things worth mentioning. That's a great case study showing just the power of a stool test and some programs based on what the stool test results show. Yeah. But I think that it highlights a couple of important things. Number one, with H. pylori, antibiotics don't always work.
Yep.
The breath test is not always accurate. There isn't a 100% accurate test. So people get left back in that chaos.
Yep.
There's no order and structure to what the hell is going on again. And the medical system, again, is just going to say one thing. It's called the apostolic function. Yep. The medical system has its opinions. Apostolic function just means teaching function. So they're just going to tell the patient what they know and nothing outside of that. So yeah, the breath test says it's negative. That means it's gone. You've done your antibiotics. Yeah, but I still feel unwell, doc. Oh, we'll do more antibiotics then. Well, what if there's a resistant strain of H. pylori to the antibiotics? Are they going to change the antibiotics? Are they going to test for the resistant strain? It's just guessing games again. You're tossing a coin and going, it might work, it might not. Plus, the 2 parasites that we found are not recognized by the medical system as being problematic, whereas the scientific literature says, yes, they are problematic.
Yeah.
The medical system says, no, they're not problematic. And there's reasons for that, which we won't get into. It's to do with how much research is done that doesn't get down and filtered from the medical labs into standard medical practice. It's known for sure up here, but it's deemed as too complicated and too costly to put into the medical system in terms of general practice. So plus the testing isn't necessarily sensitive enough to find those other parasites.
Yep.
Maybe it was the parasites causing most of the problems and H. pylori was a red herring. Maybe it was all 3.
Yep.
Maybe it was just one of the 3. You just don't know, but you've got to deal with them all.
Yep.
Make sure that you do a good sweep of the GI tract.